As someone who grew up in this community and traveling to all the different offices like Elizabeth City, Outer Banks, and Little Washington, I spent so much time here. It just means so much to me that I get to come back and provide a service to the patients there in this community and help them see better. I grew up in Chesapeake, Virginia, and then went to college at the University of Virginia. And then I went to the Howard University College of Medicine for medical school and pursued ophthalmology at Howard Hospital as well. I then went to Tampa, Florida, where I did a refractive surgery fellowship, in which I did cataract surgery, a lot of advanced techniques there, and minimally invasive glaucoma surgery. My inspiration to go into ophthalmology was my dad. He's been serving patients in this community for 30 years. He's very good at what he does, and he makes it look very easy. So as a kid, when I was growing up, I got to see that firsthand, and that inspired me to become an ophthalmologist. He has helped a lot of patients with their vision and convinced me from a very young age that this was the very best job in the world. Every time I see a patient, I want to make sure that that patient feels like I'm listening, and I want to hear their concerns. And I learned something in my fellowship, and I kind of treat it as my mantra. Where's the patient? Where do they want to be? And how am I going to get them there? We can do LASIK, we can do ICLs, which are implantable contact lenses, we can do cataract surgery. All of those are methods of getting a patient clearer in their vision to be more precise. Coming back here in this community, I feel like that connection with the patient is so much stronger. One of the biggest barriers to performing any kind of eye surgery is the fear for a patient. For me, talking that patient through the procedure, kind of giving them a heads up so they're not surprised. And even before the surgery, just counseling the patient and telling them, hey, listen, you're gonna be laying down on a table for 5 to 10 minutes looking at some bright lights. Look straight at those bright lights and stay still, and I'll take care of the rest. So restoring someone's vision for me means giving them independence to do their everyday kind of daily activities. Whether they wanna do close-up work like reading, whether they wanna do bird watching and see things out in the distance, whether they want that intermediate vision kind of at the computer length. Listening to them, kind of getting them to where they wanna be. That's what makes it all worth it for me and satisfying for me. So ophthalmology is at the forefront of technology. We're always coming out with new advancements. We have robotic laser-assisted cataract surgery now that helps us take out the cataract more efficiently. We also have advanced technology lenses, presbyopia correcting lenses that can get a patient to see well at distance, intermediate, and near. We also have light adjustable lenses, which are great for our post-refractive patients that have had LASIK or PRK or RK. With those lenses, we're able to change the shape of those lenses after surgery and kind of fine-tune their vision, because measurements in those patients may be a little bit more difficult to be precise because they've had those kinds of vision corrective procedures in the past. The light adjustable lens allows us to get around that. We also have lenses that can correct for astigmatism, and those lenses are great for patients seeking great distance vision. To me, being an ophthalmologist means helping patients preserve their independence, confidence, and their ability to fully participate in life's most meaningful moments. Vision is how we recognize the faces of the people that we love. Vision is how we read the books that we love, how we experience the world around us. When vision is threatened, we lose some of that freedom, and patients lose that identity. For me, that role as an ophthalmologist is reclaiming that for those patients. For anyone who's having problems with their vision, just come see us. We're gonna do the best that we can to help diagnose what you have going on and see if we can help you out and get you to where you need to be.